everybody, welcome back to Facial Aesthetics Unmasked. I'm Dr. Henstrom here with my colleagues Dr. Thompson and Dr. Manning. We're excited to talk to you about a subject that is affecting so many people in the facial aesthetics world. We're going to talk about facial revolumization. Okay, that's a big word. It means a lot of different things. We're going to cover part of the topic today. We'll probably cover part of the topic in our next episode. But we're going to talk about fillers, specifically using facial fillers to put volume in the face. Dr. Thompson, when you see a patient, why is it that people would need or want fillers in their face?
Yeah, so a lot of times people, when they hear the word filler, they think of the sort of overfilled face. And I've seen people from Hollywood, I don't want filler in my face. And, you know, the reason that a lot of people get filler in their face in the first place is that as we age, we actually lose volume in our faces. I've noticed in my own face that it's just not as full as it was 10 or 15 or 20 years ago. And that's just because of some of that fat that we have in our face just kind of disintegrates or atrophies over time. And so part of the aging process or the anti-aging process to try to restore some of that volume.
Okay, so I think we can all agree, and it's certainly one of the telltale signs of aging is that people lose volume in their face. Gravity also affects us. There's different solutions for those problems. We'll talk later. Dr. Manning, when you see a patient, what are the signs of that facial volume loss? How do you diagnose it, and how do you point it out to patients?
You know, honestly, the patients usually point it out to me.
Yeah.
And I like to ask them where their areas of concern are. And those areas of concern usually involve areas like the temples, which can hollow, around the eyes can hollow, especially the groove here under the eyes. Like you're saying, you lose the fat in the areas you want it, like up over the cheeks, and you gain it in the areas you don't want it. And so often the cheek is another area where people want to volumize again. And then there are other areas that you don't necessarily think of all the time, such as the jawline, where filler can be really useful.
Or the lips. You know, a lot of times people don't even realize, and there's sort of a stigma against getting filler in the lips because we've all seen people that have had too much filler, over volumized. But that's one of the places I actually often am trying to encourage people to get volumized because they just don't realize that the lips, as we age, they sort of disappear in a way. And if you just get a little bit of filler in there, a little bit of volumization, it looks so much better and it doesn't have to look overfilled.
Certainly doesn't. And we've all seen patients like that. We certainly don't want to see that out of our patients. That's not how we want to be here at Utah Facial Plastics. Dr. Manning, you mentioned a number of areas. The temples, around the eyes, especially underneath the eyes and the hollows. The cheeks, both central cheek as well as lateral cheek. Lips are mentioned down in the jawline. So we've got a number of different places in the face that we can see atrophy or volume loss as we age that we may want to restore a little bit of the volume to help restore a youthful look. There's different options out there. Dr. Manning, I'll start with you. What would you use in different areas of the face as far as fillers are concerned?
So if you're trying to build up structure or volume in an area like the jawline, I like to use a firmer filler. I'll often use Juvederm Ultra Plus XC down in those areas. It gives a lot of structure. I feel like you get a lot of longevity out of those areas where you're trying to augment bony structures underneath. And in the lips, I'll use something like a Restylane Kiss or maybe something like Volbella that's softer and is not going to be quite as irregular when you're working under, thinner tissue.
A little more malleable. Mm-hmm. Okay. Dr. Thompson, what about under the eyes or in the cheeks?
Yeah, I'd say in the cheeks, kind of the same principles that Dr. Manning just mentioned. When we're trying to augment areas that are over bony structures or solid areas, we tend to use a more robust, a more kind of dense, concentrated filler like a Juvederm Ultra Plus or a Voluma. Now, all of these fillers we're discussing are in the family of hyaluronic acid fillers, which is probably the most widely used filler today. They're extremely safe. They don't have to be allergy tested for. They're actually reversible. We haven't even gotten into all those features of them, but that's probably the gold standard at this point. But in general principles are movable areas, softer fillers, more solid areas, or more immovable areas. We use the more dense fillers.
You hit on some really important things. Most people are going to be most familiar with the hyaluronic acid family of fillers. Two big leaders in the market are Galderma and Allergan. So those are Restylane products and Juvederm products. That's the majority of what the hyaluronic acid fillers are out there. There's multiple subtypes in each one of those families that we might consider for different uses in the faces, fine lines versus deeper spaces, building up structure and so forth. So it's really important, if you haven't done it before, or if you have and you just aren't satisfied, to come in and see experts that have a full armamentarium and are familiar with these different products so they can make the right recommendations for you. So as you mentioned, hyaluronic acid fillers have a way to dissolve them. If you don't like them, we can dissolve them and get rid of them. Not all fillers are like that. Dr. Manning, how about you talk about the use of maybe Sculptra, and how and where you might want to use that?
Sculptra is a really great filler because it actually induces your body to make its own collagen. And so I think in the original studies, they were kind of finding with suture material that you would get collagen buildup around that suture material, and someone had the idea to harness that and inject it into the skin and then in micro droplets, and then have the body build up its own collagen around it. So that's kind of how Sculptra works. It worked great to volumize the cheeks. I know that our injectors are also using it kind of diffusely to help with lines in the neck. It can be injected in kind of a more spread out pattern to accomplish that. The nice thing about it is it lasts a long time. You're getting a couple of years out of something like Sculptra, whereas some of the other fillers, usually you get around a year out of them, depending on how mobile the area is that it's being injected into.
Meaning the more mobile an area a filler goes into, the less time it's likely to stay around. It's
Correct.
going to get broken down by the body a lot quicker.
Yeah.
Do you use Sculptra much?
I don't use Sculptra too much, but we have both you and Dr. Manning and some of our other practitioners, which we're going to talk about here in a minute, who do use it. And one thing I was going to say about Sculptra is, we're talking about all these different fillers, and it can become very confusing because we haven't even touched the surface of what there is. There's just so much out there. And so that's why it's important to have kind of an individual evaluation so we can help you determine what would be best for you. But the point I was going to make about the Sculptra is, as Dr. Manning said, it's a longer lasting result, but it's also a longer result to see kind of the benefit from it because it does build the collagen. And so if we want something that's more immediate and the patient can walk out of the office and say, wow, I can really see a difference, then we're going to more likely choose one of the hyaluronic acid fillers.
Yeah. So Dr. Manning touched on the fact that Sculptra is made out of polylactic acid. It's micronized versions of common suture material that we use in stitching people up that would eventually dissolve, and that's why it does stick around a little longer. Another class of fillers that we can talk briefly about, calcium hydroxyapatite fillers, commonly known as Radiesse. And I don't think any of us use that a lot, but you might want to consider using that down on the bony structures, like for jawline development and so forth. I think some of our nurse injectors use that a little bit more. Then there's some fillers that have been around for a while that we're not fans of, and they tout themselves as permanent fillers. And there's a downside to that, because when permanent fillers go in, they can be permanent, and if they're not done well, then they show, and it's hard to undo that. They don't have a way to reverse their placement or to dissolve that product, and because of that, we've seen plenty of patients who've had this put in, and they've had negative sequelae. If not immediately, even years down the road, it's still prominent and becomes more and more visible. So avoid some of those products if you can. If you have any questions, please feel free to come in and talk to us about it. So wrapping up, Dr. Manning, what would you say are some of the risks to educate people who haven't had it done or are unaware of? What should they know about the risks of getting filler in the face?
It's actually really interesting because when I inject someone, they've been injected before, I'll often talk about them, and it's like new information. You want to make sure that you know the risks of any procedure that you're going to have done to you. But with filler, the main thing that you're worried about is that filler going into a vessel and blocking off that blood supply that vessel is providing to skin or the other tissues of the face. It's very, very uncommon for that to happen, but it is possible for that filler to block off the blood supply, and you can have some loss of the skin in the area that is supplied by that blood vessel. If it were to go into a blood vessel that goes back to the eye, there could be vision loss. So for those reasons, it's very, very important to go to somebody who has a lot of experience, who uses techniques that help to mitigate the risk of that occurring. And really, when you look at the studies, the thing that impacts that, or brings that risk down the most, is going to someone who does a lot of it and has been doing it for a long time.
Absolutely important. And they know the risks, and they're willing to talk with you about the risks, because the risks are very minimal, but they can be very severe. You should also make sure that anywhere you go to get injected, they have a plan to immediately treat and reverse signs of an intravascular injection right away. They should know, and they should have on hand the materials that are needed and necessary for that, so they can try to reverse it if necessary. Any other comments about the risks or thoughts about
the only
patients?
thing I was going to say, kind of along the lines of what you already mentioned, is that you could just think of it, oh, this is just a simple injection. I'm just going in to get a filler. I'm just going to get my lips done. There are real risks with this. And so even though it's just a needle under the skin, it's being injected in some very vital areas of the body, of the face. And so the risks are real. They're very low. That doesn't mean you shouldn't do it. The benefits are tremendous. But it is important that you don't just choose anyone to have this done. And not to say that if you and I inject it, there's no risk. There still is risk. But we know the anatomy. We're actually in there surgically all the time, looking at these areas. We know where the vessels are. We know where the nerves are. And so we can mitigate risk. We can do all the things that we need to try to minimize the chance of an issue having. And that applies to the rest of our office and our staff here at UFP, which I think we're going to talk about for a minute.
Yeah, and case in point with the risk, and Dr. Manning mentioned some of the risk in the areas for blindness. The highest risk is areas of the nose. When you get a nasal injection, what some people would refer to as a liquid rhinoplasty. We here at Utah Facial Plastics take that serious enough that even though we fully trust our nurse injectors and they have amazing experience, when it comes to the nose, it's the physicians here that will inject the nose and not the nurses. That's the one area that we kind of take off their plate, because we want to mitigate that risk as much as we can for the patients. But having said that, I want to say a few words about our injectors and what you can expect here at Utah Facial Plastics. So Dr. Thompson, I'll let you talk about them for a minute.
Yeah, so we have probably 6 to 7 nurse injectors here at Utah Facial Plastics, and they've been here anywhere from 1 or 2 years all up to almost 10 years. Alfie's been with us for a long time now, and Gina as well. And there's a reason that they've stuck with us and that we've stuck with them. We've trained together. We continually support their ongoing medical education. We've sent them to a lot of conferences, a lot of trainings, a lot of seminars. And so they're very capable and very experienced, and they've seen thousands and thousands of patients. And there's one thing that you have here is continuity. A lot of medical spas that you go to, because there's just constant turnover, you just don't get the consistency. And it's not just about going in and getting an injection and going home. There's a longitudinal plan that needs to be in place for your face, and also just the comfort of being with somebody that you know and that you trust and that's treated you before. And that's what we have here at Utah Facial Plastics. We don't have a lot of turnover of our injectors. They tend to come and stay, and that's something we're very proud of, but also something that you can take comfort in as a patient. Okay.
Dr. Manning, any further closing thoughts?
I think we've covered it pretty well, and I think it'd be a nice segue into the other, volumization topics that we'll have coming down the line.
Yeah, we'll speak further on other episodes about the next step in volumization. We've talked here about intra-office filler injections that can be done, and there's pros and cons with that. It's easy to do in the office. You're out of the room, but there's some downsides, and maybe there's some limitations to that. And that's where potential facial fat injections come in, and facial revolumization with your own fat can play a role. So stay tuned for a further episode with that. Everybody at some point, I tell my patients that you age out of the real usefulness of just using filler to help with facial volume loss. At some point, you usually need surgical options. I think that's where some people get into problems. They keep on trying to fill a face over and over and over again, and they don't go to that next step, and that's where some of those bad outcomes of overfilled faces come. We'd like to avoid that. We know a lot of people out there that are watching this video. You may not be near us. We'd still love to see if you can get to town here in Utah, but if not, hopefully we've given you some pearls, some things to think about and to know about. So if you go see your local providers, you know the questions to ask, the things to look for, so that you get treated right, so that you avoid complications, that you have a good outcome. So that's what we're hoping for you. Thanks for tuning in. We appreciate it, and we look forward to talking to you again.